I am so delighted and honored to see so many of you, and thank you for spending part of your Saturday afternoon with us. This is going to be a mainly experiential session. I hope that everybody learns some new things. We have a wonderful lineup today. This discussion is also in collaboration with the Headache Cooperative of New England, which is a group of headache practitioners kind of in New England, but there are people who've strayed out further. And we are just really honored and delighted, as I said. So I'm going to share my screen and get started. All right, so the name of my talk, A Path to Migraine Wellness. I first am just going to tell you all a little bit about migraine, which I think all of you probably know. It is more than just a headache. If you were sitting in front of me, I'd ask you to raise your hand if you knew that was true, and I'm imagining every hand going up. It is a whole body process that affects much more than just the head pain that people experience. To date, there's no cure. Treatment traditionally has focused on medications. And you heard Katie mention I'm particularly interested in integrative and non-drug therapies, and we're going to be focusing on both medications, the newer medications, as well as integrative therapies this afternoon. We want to talk about how migraines sufferers, people who have migraines, feel like they can have control over their disease, and some good ways to find some resources, support, and help. And you just got an excellent introduction from Katie with some ideas about the Miles for Migraine group. And I encourage everybody to look into that and follow up on those resources if they're interested. So breaking it down, I want to understand or help you to understand the science of migraine, that there are genetic and developmental factors that can contribute. So both a tendency within one's family to develop migraines. I have a colleague who is a migraine geneticist who is working on this, trying to identify some of the very specific genes that predispose people to migraines. There are developmental factors, the way that brains actually develop over time. Those things can contribute as well. Migraine is more common in women than men. Part of the reason for that is likely to be related to hormones and the fact that women cycle throughout their lives, whereas men do not. But that's not the only thing. Women's brains are different than men's. Migraines peak in 30s and 40s, but they can be present in all ages. The clinical diagnosis, the technical diagnosis of a migraine is a headache that is one-sided, throbbing in nature, moderate to severe in intensity, and is accompanied by either sound and light sensitivity or nausea or vomiting. There are about 17 different variations with that. There's migraine with aura, there's vestibular migraines, menstrual migraines, hormonal migraines, complicated migraines, hemiplegic migraines, where half of your body doesn't work properly and is weak. Many, many different variations of migraine, often not well recognized, even by the medical community. There's a paucity of headache specialists. The field is expanding. We're starting with 3 fellows in headache medicine in our program at Mass General and Brigham and Women's this July. But really important to be properly diagnosed and to make sure if you hear of a friend or a colleague or a family member who may have migraine, may have an atypical variant, make sure that you can help them as migraine people yourself, make sure that you can help them get to somebody who can make the correct diagnosis. So this is just a take through about migraines that I think all of you may be familiar with, but I want to just run through it quickly. So interestingly, the process of a migraine may start 24 hours before you as a migraine patient feel anything. So there are already changes taking place in your body. A lot of people will have fatigue, restlessness, this sense of foreboding, something's going to happen. They know it's coming. People are so smart and aware of what is changing in their bodies and the fact that they're about to get a migraine. The early signs, a prodrome, that feeling of fatigue or sometimes hyperactivity even, some people, probably 1 out of every 5 migraine patients will get this aura, and it can be visual aura where you can see sparkles, squiggles, a hole in the middle of your vision. All of these things have medical names. Auras can involve numbness and tingling on half your body. Auras can be weakness on half your body. They can be word finding difficulty. Many of them look like precursors to a stroke. As you get experienced with the aura, you begin to be able to recognize exactly what it is. But for people, again, who aren't familiar with what a migraine looks like, these things can be extremely scary the first time. The migraine itself is the ictus, which is the word for the event. Okay, it's not a seizure, it's the actual migraine, but it doesn't always involve the headache. And so for some people, the nausea may be the most prominent symptom. It may be something else. So it's all a continuum. The best way to really understand a person's migraines is for that person to kind of keep a log and write things down and then share them with a medical professional who can really help to understand, parse it out, and figure out how to best treat. The postdrome, people call that the migraine hangover. That's the recovery period, and it can last for as long as 24 hours after the other symptoms have resolved. And again, I just encourage everybody to give themselves space if they're able to do that afterwards, so that they are able to let their brain and their body recover from this dramatic, horrible event that has taken place with pain and other symptoms. So step 1, recognizing what's happening, finding a medical care provider, is the first step on the pathway to migraine wellness. And here are a couple of good resources for you. And I think Katie mentioned a few for those of you who are already on the Zoom at the beginning. Miles for Migraine, terrific group, really supportive of people with migraines. The American Headache Society has patient-directed resources that are free. You don't have to be a member to access those. The Migraine Research Foundation has some references as well, ways to try to find local practitioners. Ask your friends. For all of you, I feel like you know this, but so maybe you're the friends that people ask. This is a common condition, and 38 million people at this point are felt to have migraines or considered to have migraines. That's a ton of people. There aren't nearly enough healthcare professionals to treat all of those people. And part of what we do as headache professionals in this field is to try to educate our primary care colleagues and other colleagues so that they can get treatment started. You can ask your PCP, or if you're a woman and you have a gynecologist, that person may be able to identify a migraine specialist who can help you if you need one. If the first visit with a new headache doctor is not a positive one, please feel empowered to keep searching. Your healthcare professional, physician, nurse practitioner, physician's assistant should respect you, understand what the migraines are, not minimize what you're going through, and be able to help you create a plan that you are comfortable with. Really important. It's not your fault that you have migraine. The condition should not be minimized, or I'm going to add to my slide here, it should not be stigmatized. So you finally found a migraine specialist that you want to work with. What do you do first? And here are a couple of ideas that if you were coming to see me, let's say for the first time, and you showed up with a diary and a log of things that you thought were important about your migraines, maybe when you get your period, if you're a woman, your sleep cycle, your exercise habits, food, all those things, that would be super helpful at the beginning if you were able to include that. Stress is really important. We are in a state of heightened stress during this pandemic. This is really triggering migraines for a lot of people. But regardless, stress is really important. You can bring this information to your first visit. Some electronic medical records allow you to, allow you to send that electronically ahead of your appointment. When I get that information, I read it before I see the patient, before I see one of you, so that I know a little bit more about you at the beginning. But study it yourself. Nobody knows your brain as well as you do. So that's kind of our mantra, right? You are the one who's experiencing this, and it pulls for you to be able to advocate for yourself and hopefully find really good practitioners to work with. Make a list of treatments that you've tried, medications, preventive, abortive, any of the newer biologics. We're going to have a talk about that after I'm finished. Have you ever tried Botox? Have you done an elimination diet? What's worked? What hasn't worked? What are you interested in? Come prepared with those questions. So in terms of lifestyle, we're going to be focusing on some non-drug therapies and some experiential components this afternoon. How do you exercise? How do you include it? If you have a headache a lot of the time, it's hard to get exercise in. My colleague Meredith Beatenstar will speak a little bit about meditation, mindfulness, and maybe just a couple of ideas about ways to include exercise. It doesn't have to be anything dramatic. Just keep this in mind. Anything you do is better than if you didn't do it, if you're able to. And maybe that's a walk around the block. That's great. Hydration, really key. We're going to come back to this over the afternoon. Are you getting regular sleep? Saturday, Sunday, try not to sleep later. Even if you're tired, get up at your same time, and then maybe take a nap later in the day. Thinking about stress, how are you going to manage it? What is going to be helpful? With the, again, in these, I'm really tired of the word unprecedented, like we've all heard that enough at this point, but during this pandemic, stress is just, I feel like it's orbiting around all the time. What are some ways to manage that? What are the things that we can control? What are the things that we are able to change ourselves? There's a lot that we can't right now, and a lot that we are just really waiting patiently to get to a point when the world feels safer. So we talk about homeostasis in our group at the Osher Center for Integrative Therapies, where I practice quite a bit. Homeostasis is basically trying to keep everything the same all the time. Migraine brains do not like uncertainty. Change is that much harder when you're presented with the challenge of being a person who has episodic or chronic migraines. The more you can do to improve your overall wellness, the better. It's like kind of keeping all the gas in the car and keeping the engine tuned up, so that if there is something that happens, you are that much better insulated, okay? And trying to schedule your time. And again, I feel like this current way of life, the fact that we're now having this Zoom meeting, all the things that we do really pull for having to slot things in, schedule things. Please slot in downtime, rest time, exercise time, quiet time, and socialization. Those are all super important. Who's not sick of this picture, right? I can barely stand to look at it. The pandemic has just really undone so many things that people had in place in terms of managing their lives with migraine, without migraine, and it's been very difficult. We have vaccines now. Very shortly, everybody is going to be able to get one if he or she wants one. And if you have questions about that, I really encourage you to speak with a trusted healthcare practitioner. I think that things will change. We're going to get out of this. I believe Dr. Fauci when he says that. It's been an exceedingly difficult time. So the stress now that we face of every type, worrying about our family, worrying about job security for us, partners, loved ones, family members, worrying if you have kids at home, trying to homeschool them, hybrid schools, some days they're live, some days they're at home, running that, having a 6-year-old or a 7-year-old trying to do Zoom is certainly difficult. For some of you, taking care of grandchildren, working with them, trying to get them to do their schoolwork, and maybe running your own job, running the family at the same time, exceedingly difficult. Finances for a lot of people have been so hard. Sources of income may have dried up. The loneliness, the isolation, whether you are a person living alone, whether you're a person in a bubble with family members but not able to go outside of that. The things that we have done that have kept us centered in this world have eroded due to the pandemic. And then on top of all of that, fear and anxiety around getting infected, what would that look like? How would we manage and how would we get the care that we need, especially with migraines? So basically, so much control is lost, right? It's migraine mayhem, the bells are ringing. And what can we do? What is within our control? What is not within our control? And I think this really, I'm sorry, my slides are jumping around here a little bit, but what is the pathway to migraine wellness, whether there's a pandemic or not? I think the first thing is what I've really tried to highlight a little bit for you. It is what's going on in your brain, what can you control about it, and what can you not? And then how can you keep your body as fit as possible in the setting of having a chronic pain condition that is not at this point curable? How can you keep your spirit really balanced? And Meredith is going to talk about that. My colleague, Dr. Matt Kowalski, is going to talk about neck and shoulder wellness. My colleague, Dr. Andrea Harriet, is going to talk about these new biologics. Fitness, what can you do to be as active as you possibly can? It's going to be really important. And my other colleague, Lindsay Bronstein, is going to talk about nutrition in the setting of migraines. So we're going to give you some ideas that may help you move along the path to migraine wellness as much as possible. So work with your team, use the things that you know the best, create a schedule, stick to the healthy habits, which many of you know, and as I said, I hope you learned some new things this afternoon that enhance that. Line up care providers who support you, who you trust, and who respect you with a shared approach to your care. See what can be virtual. Staring at a screen is not great. Dr. Kowalski will give some good ideas for shoulders and neck health when we're sitting facing our screens all the time. For people with migraines, it's just so hard. When I do Zoom visits with some of my patients, so difficult to have to stare at the screen hour after hour. Give yourself breaks if you can do that. Plan ahead if you know it's going to be a tough day. What can you do that might make it easier? Plan your snacks, plan your breaks, shore up your support, remind your inner circle, there may be a pandemic going on, but I also have migraines and I need these kinds of supports that have always helped me. And then creating boundaries, I think is really hard. But I think it's super important, especially right now. When can you turn it all off? When does the day end? I told Meredith a story last week. I was speaking with one of my colleagues who is a surgeon about a shared patient. It was 9 o'clock at night. And I said to her, we really need to both turn off our computers and shut down and relax a little bit. She said, I still have more patients I'm going to do Zoom visits with. And that was 9 o'clock at night. And we both laughed because boundaries, she's wonderful and wants to be available, as I think we all do, to support each other. But time has taken on a really different flavor with the pandemic. And I don't think it's necessarily a very good one. So creating some boundaries, okay, after this session is done, maybe turning off the computer and sitting quietly in a shady place outside, if it's as beautiful where you are as it is here in Boston today, it's 70 degrees, whatever you can do that allows you to have some space for yourself. So things that aren't helpful for people with migraines, I feel like all of you could probably make this slide better than I did. Dismissive treatment, being told that migraines are the least of it. We're in the middle of a pandemic, so you have a headache. Not helpful. Turn that off. That's where you walk away, right? Giving yourself some space and then getting caught in this loop of anxiety about getting sick, anxiety about the next migraine, anxiety about managing all the additional stress. And again, I hope that you come out of this with some new ideas for things that are helpful for you. Limiting screens, and I put here, let's face it, that's pretty much impossible right now, but as much as you can do it, I think it does help with overall migraine wellness. These are some of the ideas of non-drug therapies: chiropractic care, movement therapy, yoga, integrative health coaching, nutrition, acupuncture, craniosacral therapy, meditation, and mindfulness. A lot of these are things that you can do virtually. You can create your own practice. Some of them, you may want to wait until you feel that it's safe, that there's a really low risk of being in a setting with other people for some of these things. Individual decisions. I've been recommending virtual yoga to people all year and have been doing it myself and have found that's just very helpful. Meredith is going to show you a couple of yoga stretches that you can just do seated in a chair. But trying to line up things that aren't drugs in addition to your medication, and for some of you, maybe in place of medication. Support from other migraine sufferers. Katie opened beautifully when she talked about how critical this is. And so just in conclusion, the agenda for this afternoon: the advocacy, new treatments in the pipeline, meditation and mindfulness, neck and shoulder care and wellness, and then nutrition and how to do healthy eating. So we're so glad you can join us. Our goal is that everybody will learn at least one new thing about migraine wellness. And thank you all for coming. I don't know, Katie, you tell me if I have a few minutes to take some questions or if we're ready to move on.
Yeah, your timing is great. That was wonderful. Thank you so much. We have one question here. If anybody has any questions, you can certainly put what you might have in the chat. We have a question here. Someone said that they are regularly awakened by scary dreams during deep sleep. It triggers migraine for them. Do you have any thoughts or suggestions as to what they might be able to do to, I guess, combat that so it doesn't happen? Or, you know,
yeah,
what to do to help?
That's a great question. That's a question really worth talking to your own doctor about, but I will tell you that there is, and again, thinking holistically, really important. There is a medication that's sometimes used for both migraines and nightmares. Really amazing, right? One drug that can do two different things. The name of the medicine is clonidine. It's a blood pressure medicine, but a very low dose of that can actually treat both nightmares and it can treat migraines. So write that down, whoever asked that question, and maybe ask your headache specialist if that's something that you could try, or if there are other possibilities.
Great, thank you so much. Let me see. I find barometric pressure changes are a fairly consistent trigger for my daughter and myself. How do we battle uncontrollable environment changes?
Oh, that again, such a great question. One of my colleagues said that he never looks at the weather. He just asks his migraine patients what's going to happen because they invariably know. People with migraines are so exquisitely sensitive to changes in the barometric pressure. We don't really know why that's the case. Short of moving to a place like Arizona, where the barometric pressure is absolutely consistent all the time, not something you're really going to do, maybe not in general, and certainly not right now. Nobody's going to move anywhere. You know, I think trying to be ahead of it, trying to anticipate that this may be a trigger for you, be ready with your abortive medication, do as many healthy things as you possibly can. So really think about, am I going to hydrate well? Am I going to get my sleep in order? Do I have an event that might be stressful that I could maybe move to a different day if there's a storm coming? Anticipate as much as you can, adjust whatever you can.
Great advice. That's great advice. I'm one of those barometric. I could be a weather person myself. Okay, one more question. I had my first vaccine on Tuesday and have had a migraine ever since. Do others have experience about this? And is there something, maybe advice for those that haven't had their vaccine yet, that something they can do before their vaccine?
So I would say, in addition to the usual questions that I'm getting right now from people, I'm probably getting an additional, conservatively, 25 to 40 a day about the vaccine. And the answer to that question is, I don't know. These are really, in my opinion, as a physician, these are excellent vaccines, really able to protect us against getting seriously ill or, heaven forbid, dying from COVID. People do get symptoms. There's a lot on social media about who's more likely to get symptoms, who's less likely, which vaccine, but none of that is proven at this point. So what I would say is, if you get a bad migraine, you can treat it with your migraine medication safely. Give yourself, do that anticipatory planning in the same way when you're going to get your vaccine. Maybe block off the next day if you have the ability to do that. Be prepared to rest, drink a lot of water, take it easy, have your ice packs ready, have your migraine medication ready if you need it. But please, don't let that keep you from getting the vaccine if you're cued to get it. Okay, so again, I can't give any of you specific medical advice, but I can tell you that of the many, many patients now that I take care of who've had the vaccine, some of them have gotten bad headaches. Everybody has gotten through it. And I will tell you personally, it's a relief to have that immunity. It feels great to be on the other side. So I encourage you, and I encourage you to talk to your own healthcare professional about any specific questions.
Yeah, 100%. I agree. I'm totally vaccinated. And for my second one, I just prepared. My preparation, I think, was key, and just prepared for the worst. And luckily for me, I had zero reaction. But I was totally prepared. So thank you so much for your inspiring presentation. Those of us need to remember, I think consistency needs to be our middle name, right? So thank you so much. I'm going to let